This was a sight Cheryl Larenko never wanted to see. Her mother lives at this home. Larenko races to it every time she hears sirens.
I watched it. I watched them come out in their white hazmat outfits. It's terrifying. And to be left in the dark, to not really know, why are they going in there, right?
Someone who says they were among the paramedics responding to a 911 call Friday at the home posted this message on Reddit, describing what they found as something out of a nightmare. Paramedics treated at least a dozen people and sent 3 to hospital. 2 people were already dead when they got there.
It is not a usual, I'm going to say, scenario in a personal care home.
The Winnipeg Regional Health Authority and operator Revera confirmed 8 people from the home died within 48 hours and announced the deployment of a backup healthcare team to the site.
8 deaths in less than 48 hours and a paramedic speaking up. Why did it take that to finally get some relief?
This was devastating news.
On Sunday, Manitoba's health minister launched an investigation into 2 care homes run by Revera, where together 45 people have died since the pandemic began.
Keeping COVID-19 out of our care homes has been one of the greatest challenges. More clearly needs to be done.
As the Winnipeg police lead their own assessment,
it's too late. We've had 22 deaths in less than 2 weeks in Maple's personal care home. And the cries for help with staffing, that had happened already.
Her mother doesn't have the virus, but she worries it's just a matter of time. Erin Broman, CBC News, Winnipeg.
So let's hear what Dr. Isaac Bogosh has to say, as you know, an infectious disease doctor here in Toronto. And Dr. Bogosh, why do you think we're still seeing record case numbers in Ontario and Quebec, even though both provinces have tightened restrictions in hotspots for a few weeks now?
Yeah, it's really unfortunate to watch these numbers present themselves with record highs. I think the measures that have been taken have actually done something. They just haven't done as much as we would have liked. So they've likely slowed the rate of growth, but of course we haven't seen it plateau or decline just yet. And to really get that, we need to have a better understanding of who's getting infected, where they're getting infected, the context to which they're getting infected, so you can have data-driven policy to get those numbers down.
And as we just saw in Winnipeg, 2 care homes have been the site of deadly COVID-19 outbreaks. Given all that's happened in this country months ago, why is this still happening?
It's really unfortunate to watch. We know that about 80% of the deaths in Canada are from long-term care homes. Are there lessons that we learned from the first wave? It's not entirely clear if those lessons have been implemented, but certainly there's been policy to help prevent the introduction of cases into long-term care facilities, and then infection prevention and control measures should be implemented such that if it is introduced, it can't be transmitted from person to person. We've seen this in a few other places outside of Manitoba. We're seeing this in Ontario and in parts of Quebec, and I think we need to step it up to really help protect the most vulnerable amongst us.
Dr. Bogosh, thanks a lot.
My pleasure.